Hey everybody, Dr. Duresti back with another video on cranial release technique. And the last few videos I've been talking about different questions from practitioners. Again, I got a few more emails reminding me to just explain a little more about the balloons in the nose, which again, we do not use in cranial release. So sorry to tell you, no balloons in the nose. But then the second part of the story was, again, review the concept of children and the importance of the cranial release technique and children and babies, children, teenagers. So again, let's start off with the adult skull so you can just see the different colors representing the different bones that make up the skull. 22 cranial bones. They never should fuse, they should stay separate. And again, the reason why that is about 100 years ago, Dr. Sutherland, an American osteopath, came up with the discovery of the reason why those 22 bones need to stay separate is because there's moving. They are moving. There's a reason why Mother Nature kept those 22 bones separate. Sure, one large solid bone in theory would be better for protection, but nature knows best, so there must be some reason why these bones need to move. He termed it the primary respiratory mechanism. He said that this is what comes first. This is what's then enhancing central nervous system function, which we know controls and coordinates every function of the body. The things that we're aware of, the things that we're not aware of. The musculoskeletal system, reflexes, hormones, digestion, respiration, cardiac function, blood pressure, all these things are under the control of the central nervous system. But yet when you think of it, how many times have you gone to a healthcare practitioner with any one of those troubles? Digestive issue, a musculoskeletal trouble, cardiac issue, pulmonary issue. When did they ever connect that back to the central nervous system? Well, probably unless you've gone to a chiropractor or some holistic type practitioner, probably none of them have. But of course, we all learn from the same books in school. We all learn that the cranium, the skull, protects the brain, and the brain controls the function of the body. So now when we talk about children, and of course, we talk about the birth process. So here's a plastic model of a fetal skull. And if you look here, and this was molded from a real skull. And if you look in the camera, I'm not sure if you'll be able to see, but one of the eyes is smaller than the other. One of the eyes is lower than the other. The ears are completely rotated as well. If you look down from the angle I'm looking at, I don't know if you can see it from the camera angle where you are, but the whole entire cranium is rotated. This whole baby's head, if I look down like a clock, it's rotated. All 22 bones have shifted and rotated. And unless someone got to this child right at delivery or shortly after, that distortion pattern is going to stay with that child probably for the rest of their life until they can get someone to sort of unscrew it, for lack of a better word, to rebalance it. And that's exactly what the cranial release technique does. So as the baby's head comes and passes through mom's birth canal, those 22 cranial bones are getting compressed. Compression, compression, compression. The skull exits the birth canal, and now we get decompression, or what we call the blowout phenomenon. That's what kickstarts this primary respiratory mechanism. That's what, in theory, should now take this child for the rest 60, 70, 80, 90, 100 years down the line to keep them happy and healthy and functioning optimally. Sure, all the things that we always think about, how do you stay healthy? Well, you have to eat right. You have to have exercise. You have to get proper rest, proper mental attitude, go out in the sunshine, exercise. All those things are so important. Nutrition, of course. but no one talks about cranial function. So the cranial release technique is designed to do one thing: to take you wherever you are down the line, whether you're 20 years old, whether you're 40 years old, whether you're 60 years old, whether you're 80 years old, whether you're 90 years old. Take you from wherever you are with that distorted, restricted cranium, apply this technique, which literally takes about a minute to do, to unlock and allow these bones to start moving again, allow the cranium to breathe fully again. Hence the name cranial release technique. So, and again, just to be clear, this is not a one-time event. Yeah, one cranial release is great, but why not have it done on a regular basis? Because we're constantly under stresses: physical stress, emotional stress, chemical stress, problems at home, problems at the job, problem with the family, problems with the economy, problems with the world, whatever it happens to be. That stress constantly is trying to bind down the cranium, and we want to do is keep it free flowing and moving and breathing. And that's the purpose of the cranial release technique. And that's why I receive cranial release technique on a regular basis. And I mean regular basis, probably weekly, sometimes more than weekly. If I have a stressful day, if I have a stressful time, whether I'm playing sports, whether family issues, whether all the stresses that you have, I have. So we all benefit from cranial release technique. Visit the website, cranialrelease.com, where you can locate a practitioner in your area. And if you are a practitioner and you're thinking of, gee, what about adding this to your acupuncture practice, to your chiropractic practice, to your physical therapy practice, to your massage therapy practice, to your naturopathic practice, to your medical practice, to your dental practice, to your whatever type of practice that you do. You're an energy worker. You're a holistic healer and you use herbs and nutrition. Whatever it is you do, everything will work better when the central nervous system works better. There's a button on the website called Online Training Program. If you click that button, that'll take you to a different page where you can learn more about how to learn this work in the comfort of your home or office. This is Dr. Duresti with the Cranial Release Technique, getting ready for the holidays. So be well, my friends. Talk to you soon, and adios. Goodbye.